Well, hey there, friend, and welcome back to the episode. Now, I have no idea why you're here, but I know you're here for a reason. And maybe you have been sitting on this myofunctional therapy thing for a long time. Maybe it's just new to you. Maybe you found out about myofunctional therapy somewhere, like maybe a colleague mentioned it. Maybe you fell down the ever deep YouTube rabbit hole at 11 p.m. and you just started clicking around and you discovered that maybe this is something for you. Then you got really excited about it. And then after that, you talked yourself out of it because you thought that learning something new meant starting over. Now, a lot of you guys in my community and in my sphere, it blows my mind, but you guys have 8, 10, 15, 20, 30 years in dental hygiene, which does blow my mind because if you know anything about me, I got to year 16 and I could not handle it anymore. So a lot of people, when they think about getting into myofunctional therapy, they think that they're starting over. And that is really hard for us dental hygienists because we're type A plus personality as it is, and we're already good at what we do. So starting with something new is kind of scary. So what happens is you talk yourself out of it. And then here's what I find. If you're listening to this IRL in real life, it is June. It is the heat of summer. And now is when I start to see a lot of your guys' interest pick back up for myofunctional therapy because let's face it, you would rather be living the life that you get to design around your business rather than putting on your scrubs and going to a job every day. No matter how much you love hygiene, it's just a fact. It would be much funner to have that life first business than to be going to a job. Okay? Just going to say it. So that's what we are talking about today. Dental hygienists are in a unique position in that when they learn myofunctional therapy, they're not starting over. You're adding something to the toolbox, which I think is super exciting, super helpful. It helps your patients' lives, and it also can help your life too. So that's what we are talking about today. So let me see how many things I have. I think I probably have 5 or 6 things that we're going to talk about on why myofunctional therapy training for dental hygienists makes so much sense. So let's just get into it. First of all, it's in your scope of practice, okay? Speech therapists, dental hygienists, dentists. Now, some other allied practitioners are doing it. I know chiropractors, I know physical therapists, I know some naturopaths that are getting into it because it changes lives. But let's talk about you. Yes, the American Dental Hygiene Association has it listed as part of your scope of practice. So why would you not, right? That's number one. The next one. Most dental hygienists do not work 5 days a week, okay? And if you are, then my friend, you definitely want to learn myofunctional therapy so you can quit working like an ox, right? Okay, so most of you guys don't work 5 days a week, so you have white space on your calendar to be able to build the side hustle. So I always tell people, you don't ever just go, oh, no hygiene. Now I'm going to be a myofunctional therapist because it doesn't really work like that. However, the gas and the brake, the gas and the brake. So you're putting on a little bit of the gas to start building your business. So if you're not working full-time as a dental hygienist, meaning Monday through Friday, that gives you a step up. Okay. So the other thing is it also allows you to build that business without leaving the safety net of your paycheck. So that's good. Next, dental hygienists already understand all the anatomy stuff. Makes it super easy. Communication. So your communication with patients, you already have the relationship with them. You're already talking with them. You're already telling them what you see in their mouth. This just, this communication skill transfers very nicely, but it has just a little bit different of a twist. That's it. So you're already good at communicating. Another thing is that you already know how to assess, right? So when you come into myofunctional therapy and you're assessing function, you're assessing the mouth, how the face looks, all of these pieces of the puzzle, which of course you have from clinical training, But that's what makes it so fun. I love it when I go to do an exam and I've got their paperwork here and I've got their pictures here. And I look at their pictures and in my mind, I can create the story that I expect to see on their paperwork. Or if I look at their paperwork, I can create the story in my mind of what I expect their face to look like. And I don't mean like brown hair, blue eyes. I mean, I expect based on what I'm seeing as their symptom snapshot on their paperwork, it kind of gives me an idea of, am I going to see a long, narrow face? Am I going to see a high vaulted palate? Am I going to see tired looking eyes? Am I going to see a tongue tie? Okay. Now, yes, I know you identify tongue ties based on appearance or based on function, not based on appearance, but sometimes, my friend, there's low hanging fruit. And if you've looked at as many tongue ties as I have, they're pretty obvious, okay? So I can look at somebody's symptoms and then expect what I'm going to see in the mouth as far as a tongue tie. Crowded teeth, vertical jaw angle. I can look at somebody and say, mouth breather, low postured tongue, mouth breather, mouth breather. Okay, so you already know how to do that. So you have the clinical eye, you know how to document, you know how to communicate, you know how to assess, you know how to do all of this stuff, which makes it just that much easier for you. Now, the other thing is I think that timing is important here. So the reason that I think that I wanted to talk about this in this podcast is because now is the time. Not only is it easy for you to add the skills, but now is the time because we're kind of seeing the turn of the tides, if you will. The older, more antiquated doctors, they're selling their practices. They're retiring. They're getting out of it. So these are the doctors who aren't going to really be cutting edge. These are the ones who are going to really poo-poo myofunctional therapy. And they're being replaced with doctors. And perhaps maybe some of you guys are working for these doctors who are encouraging you to get into myofunctional therapy because these new cutting edge doctors, they're learning from some of the best. They're going to take courses with Dr. Zoggy. Okay. They're studying at the Breathe Institute. They're associated with the AAPMD. So there is so much conversation going on these days between the left hand, which we'll say the doctors, the right hand, which is like the dentists, when we talk about sleep medicine, sleep disordered breathing, airway focus orthodontists. And it is so exciting because you can't go to a conference without hearing about it. So in addition to all these other reasons why it makes sense for you to add that myofunctional therapy to your skill set, this is a biggie, okay? So you don't work full time. Most of you guys aren't working 5 days a week, so you have free time. You're not starting over. You already have the communication skills. You already have the assessment skills. For crying out loud, you have the brains. You can figure this stuff out. You just need to start by getting your clinical education, okay? I can help you with that with Learn Myofunctional Therapy in 60 days. And a lot of you guys wonder why just 60 days? And the reason is because you get to choose how long the 60 days is, but it's there for a reason. I want to give you some guardrails so that you're not still trying to learn the skill 6 months from now, a year from now, because I wholeheartedly believe that myofunctional therapy has to be put to use. You've got to get the car in park or in drive so that you can start to have conversations, so you can get more confident, so you can start to see things, so you can make referrals, so you can help people. So important. So you got to get that clinical skill. But the reason I want it to just be 60 days or as short as possible is because then I'm going to teach you the business part of it. But I don't want to overwhelm you with the business stuff. Hey, here's how you build a website. Here's how you structure it. Here's how you do SEO. Here's how you build a Google page. Here's how you go tell Google, hey, I'm open for business. Send people to me. Here's who I work with. Here's what my package looks like. All of this stuff. You got to have the clinical stuff first. So I hope that excites you. I was really excited to do this episode just because, like I said, it's summer and so many of you guys are saying, hey, I don't really like this full-time going to work, putting scrubs on gig that I'm having to do in the summer. What would life look like if I had a little bit more freedom? What if I could be more present with my kids during the summer? What if I was able to control how much I worked and what my hours were and all of that stuff? So now is the time. So, what are you waiting for? Regardless of where you're at, the very best thing for you to do is to book your unstuck call. We're going to have a conversation, see where you're at, where you want to go, how I'm going to help you get there. We're going to answer all the things. So let's land this plane. And I want to tell you, wherever you're listening to this, wherever you're watching it, grab that link, book your Get Unstuck call so that next summer you can be living a life that you are bonkers about. That's a wrap, my friend. I will see you soon where we will be back talking more, starting, growing, simplifying your myofunctional therapy business. I'll see you then.